Hi everyone, my name is Tang and I'm a medical student studying at Flinders University. Today I want to talk about some of the research that I've been doing with the Flinders Precision Medicines group, looking at dose adjustments and cancer survival. To give a little bit of background, I want to talk first about what dose adjustments are. When patients are on chemotherapy medications, they may experience side effects. When these side effects become severe enough, they may warrant a change in the patient's medication. These medication changes may come in the form of a dose reduction, a dose interruption, where a patient's medication is stopped and started again at a later date, or stopping the medication completely and moving on to another agent. We were interested in how these dose adjustments impact patients, and that led us to our research question. How do early adverse events requiring dose adjustments impact overall and progression-free survival in advanced HER2-positive breast cancer patients? The patients that we looked at had advanced HER2-positive breast cancer. HER2 refers to a receptor found in these patients which is associated with increased tumor growth and proliferation. These patients had to be treated with trastuzumab and emtansine, which I'll refer to now as TDM1. Trastuzumab is a medication that binds to the HER2 receptor, and emtansine is a cytotoxic agent that attacks and kills target cells. The data we got for our study was pulled from two landmark trials, Amelia and Teresa, and included 893 patients. What did we investigate? Patients were categorized into three key groups: patients who had no dose adjustment, patients whose dose was interrupted, and patients whose dose was reduced. We set a landmark at 4 months, and at 4 months we investigated how the overall survival and progression-free survival varied between the groups. The overall survival refers to whether or not the patient had died, and progression-free survival refers to whether or not the disease itself had progressed. We found that adverse events requiring TDM1 dose adjustments were not associated with altered long-term overall survival and progression-free survival. So what does this all mean for both patients and clinicians? Firstly, I think that this shows that there's a preference to manage our patients through adverse events, rather than stopping medication and moving on to a new agent altogether. Secondly, I think that dose adjustments can be the cause of a lot of anxiety and concern in patients who worry about how their dose adjustment will negatively impact their future outcomes. This study provides clinicians with the ability to provide evidence-based counseling to tell patients that they will not be negatively impacted. And finally, this study is in line with the idea that adverse events may actually be associated with on-target pharmacodynamics. Adverse events may not actually be associated with poorer outcomes, but may illustrate that a patient is perhaps more sensitive to the medication and just requires a lower dose. So that concludes my talk for today. Thanks for listening and watching. And also thank you to all my supervisors and colleagues who helped me with this research. If you were interested and wanted to read more about this topic, the article that I've based this talk on was published in the Breast Cancer Research and Treatment Journal last year. A link will be provided in the description below. Thank you again.